Hi everyone, good day all. This presentation will cover medication errors and their prevention. This presentation was created with healthcare providers in mind in order to educate this population on medication errors and the prevention of medication errors. Research question for this presentation is: in healthcare providers, how does the application of medication error prevention strategies compared to no application of medication error prevention strategies affect medication error rates? Let's start out by defining medications. Medications are chemical substances used to treat, cure, prevent, or diagnose a disease or diseases. Medications are vital to our role as providers. The purpose of this literature review is to evaluate the effectiveness of the application of medication error strategies in preventing medication errors. This means ensuring accurate prescribing, dispensing, administering, and also educating patients in order to prevent medication errors and to ensure patient safety. Let's discuss the most common medication errors. The most common medication errors are not double-checking medications before administration, not having or not using an EMR when administering medications. Interruptions during medication pass is also a big cause of medication errors. Also, not implementing audits with feedback. Those can also lead to an increase in medication errors. And lastly, not following the 6 rights of medication administration. The 6 rights of medication administration are as follows: the right patient, the right medication, the right indication for use, the right dose, the right time, and the right route. When searching for information on medication errors in order to be able to complete this presentation, the databases I used for information were the MAG Library, PubMed, CINAHL, and Medline. The keywords I used in searching for information for this presentation and for medication errors were medication errors, prevention, reduction, and medical providers. I had chosen 4 systematic reviews and 1 cohort study. From reading these scholarly articles, the positive result I found were that there was positive feedback on the use of prevention strategy application. That these concepts can be used for the administration of all medications, and that the use of prevention strategies were proved to decrease the rate of medication errors. When it comes to project implementation, I found that stakeholders, barriers, and facilitators of change face many issues when it comes to medication errors, such as patient and family factors and health system factors. These seem to be the top 2. Some examples of health system factors are type of facility, type of payment, level of services, definition of client, and also the types of providers. As healthcare providers, We can use clinical practice strategies when dealing with any and all of these issues mentioned. Clinical practice strategies for improving medication safety are as follows. For providers, double checking prior to administration of any medications. Also, always using the 6 rights of medication administration, and always using the do not interrupt practices. Also, implementing an audit with a feedback. And lastly, always using the EMAR when administering medications. When teaching patients and caregivers, we need to stress and educate them on the importance of not sharing medications, reporting any adverse reactions to medications, following dosage instructions, and also on the importance of completing all of their medications as prescribed. When facing disruptions during a medication pass, the use of behavioral methods for dealing with disruptions during medication administration proved to be successful. With this strategy, nurses are given the knowledge and resources to be able to control their work environment successfully and to minimize disruptions. The double checking method effects on medication errors were studied, and they were found to be an effective method for decreasing errors. And it also made staff members feel safer during and concerning their medication pass. Audits with feedback proved that the medication mistake rates can be reduced using data gleaned from regular audits. In conclusion, all of these studies showed a decrease in medication errors. A future plan would be to implement one or even more of these strategies into our daily routine. I cannot stress enough the importance of medication safety as a critical component of healthcare, affecting patients of all ages and all backgrounds. Implementing the use of these practices can ensure proper medication use and prevention. It can prevent adverse reactions, hospital readmissions, and even in some cases, death. As healthcare providers, it is our responsibility to prioritize medication safety, and by doing so, we can help prevent medication errors and ensure that our patients are receiving the safest care possible. The 5 project questions that I would like to pose to you are: 1. Can you identify the top 3 items, ideas, concepts learned from the presentation? Number 2, discuss how this information may be applied to your practice. 3, how do interruptions during a medication pass increase the risk of medication errors? Can you give me some examples of these? 4, how does the EMAR help to reduce medication errors? And finally, number 5, how do behavioral methods such as the double checking method help to prevent medication errors? I would like to thank you all for your time, and please remember, medication safety starts with you. Have a wonderful day.